Tamra Judge chose to mark her 2024 birthday with what she hoped would be a rejuvenating transformation, one that might take years off her appearance. Instead, the result became a frightening and very public ordeal. She openly documented the aftermath on social media, telling followers, "The swelling is from the CO2 laser. You can see it all the way down my chest." Tamra underwent a combination of procedures within a short time frame, including a surgical brow lift, a CO2 laser resurfacing treatment, and a blue chemical peel. According to medical experts, combining multiple aggressive treatments like these can overwhelm the skin and trigger what's often described as a perfect storm of trauma. Within hours, her face swelled so severely she struggled to even open her eyes. The chemical peel left her skin with an unusual bluish tint while inflammation spread from her face down to her chest. The images she shared were deeply unsettling. Her features appeared dramatically distorted, resembling the aftermath of a serious injury. Everyday tasks became difficult. She couldn't eat solid food, had trouble speaking, and even the sound of a television caused intense discomfort, forcing her to recover in near silence. What made this experience especially shocking is that Tamra had previously undergone successful cosmetic work, including a lower facelift in 2017 that produced natural-looking results. However, the ongoing pressure to maintain a youthful appearance on reality television may have influenced her decision to pursue more intensive procedures. Her experience serves as a cautionary tale. Even commonly performed treatments can carry serious risks when combined or pushed too far. Shannon Beador found herself at the center of intense public scrutiny after part 1 of the Real Housewives of Orange County reunion aired. Viewers immediately began asking the same question: what happened to Shannon's face? Her journey into cosmetic enhancement didn't start dramatically. It began with a cautious, seemingly sensible approach. Shannon initially opted for conservative dermal fillers, aiming to restore a more youthful look without going under the knife. But over time, those subtle treatments became more frequent and more aggressive. Like many who gradually increase cosmetic procedures, the changes added up. Eventually, her face appeared overfilled and lost its natural balance. Recognizing the issue, Shannon admitted she had gone too far. She turned to hyaluronidase injections to dissolve the excess filler. While this step was medically appropriate, it came with its own challenges. Years of overfilling had stretched her skin and altered her facial structure, so dissolving the filler left behind laxity and uneven texture. This led her to pursue a facelift, but the timing proved problematic. Shannon scheduled the surgery just 5 weeks before filming the reunion. In reality, facelift recovery typically requires at least 6 to 8 weeks for initial healing, with several months needed for full results. Appearing on camera so soon meant visible swelling, tightness, and signs of recent surgery were difficult to hide. The pressure to look flawless on television likely influenced her decision to rush the process. Unfortunately, that urgency became noticeable to audiences and sparked widespread discussion. Her experience highlights a larger issue. When cosmetic decisions are driven by filming schedules instead of proper recovery, the results can fall short and sometimes make things worse. Dolores Catania made headlines when she revealed she had undergone significant cosmetic work ahead of The Real Housewives of New Jersey reunion. Her story, however, goes far beyond a single procedure. It highlights how even initially successful surgeries can lead to long-term complications. About 9 years before speaking publicly, Dolores chose to have breast augmentation. At first, the results were exactly what she hoped for. The implants enhanced her figure, boosted her confidence, and seemed like a positive, lasting decision. But as time passed, problems began to develop. She noticed the implants no longer sat properly and had started to sag, creating an uneven and unnatural appearance. The change left her feeling self-conscious once again. What makes her experience especially noteworthy is the influence of close friends within the reality TV world. Following a recommendation from fellow cast member Teresa Giudice, Dolores decided to undergo revision surgery with the same surgeon and similar implant style. While this may sound reassuring, it underscores a risky pattern. Cosmetic procedures are highly individual, and what works well for one person may not suit another's body anatomy or healing process. Her journey reflects a broader issue often seen in the reality TV spotlight, a cycle of repeated procedures driven by appearance standards and peer influence. It also serves as a reminder that breast implants are not lifetime devices. Many patients require revision replacement or removal within 10 to 15 years. Dolores' experience offers a cautionary perspective on chasing perfection and the long-term commitment that often comes with it. Teddi Mellencamp's experience with cosmetic surgery reveals a lesser-known but deeply impactful risk of breast procedures, one that goes far beyond appearance. Before the birth of her third child, Teddi underwent breast surgery, and at first everything seemed successful. She was happy with the results and experienced no immediate complications, leading her to believe she had made the right decision. However, the situation changed dramatically when she became pregnant again and planned to breastfeed. Teddi discovered that her prior surgery had significantly affected her ability to nurse. Damage to milk ducts and changes in nipple sensitivity made breastfeeding extremely difficult, if not impossible. What should have been a natural and meaningful bonding experience with her newborn instead became a source of stress and disappointment. What makes her story particularly striking is that she was unaware this could happen. Teddi later shared that she had no idea her surgery might impact her ability to breastfeed. This points to an important issue in cosmetic medicine. Patients may not always receive or fully absorb complete information about long-term functional risks, especially when procedures are framed primarily around aesthetics. Her experience underscores the importance of discussing future family plans with a qualified surgeon before undergoing any breast procedure. For women who may want children later, understanding these potential consequences is critical. Emotionally, the impact can be just as significant as the physical limitations. Despite the challenges, Teddi has expressed a pragmatic outlook, saying she doesn't live with regret. Still, her story serves as a powerful reminder. Cosmetic choices can carry lifelong implications that aren't always visible at first. Lisa Rinna's lip enhancement journey has become one of the most widely discussed cosmetic cautionary tales in reality television. What began as a trend-driven beauty decision in the early 2000s eventually turned into a long-term medical struggle that has affected her appearance for decades. At the time, Lisa chose silicone lip injections, then a popular option promising fuller, more defined lips. Initially, the results seemed satisfactory. However, unlike today's temporary fillers, silicone is a permanent substance. Over time, her body reacted unpredictably, forming hardened scar tissue within her lips. Lisa later described these as small peas of scar tissue, which distorted the natural shape and texture of her lips. As the condition progressed, she required reconstructive procedures to remove some of the damaged tissue, but the situation was far from simple. Because silicone integrates into surrounding tissue, it cannot be fully removed, making each corrective procedure more complex. This led to years, nearly a decade of ongoing complications, additional treatments, and gradual changes to her appearance. Lisa's experience highlights a key risk of early cosmetic trends. Procedures once considered safe or fashionable may carry consequences that only become clear years later. The permanence of silicone injections made her case especially difficult, as the results could not simply fade over time like modern fillers. Her lips eventually became a defining feature of her public image, but that visibility also brought pressure to maintain a certain look. In many ways, her story reflects how cosmetic enhancements can evolve into a cycle, one where correcting past decisions leads to new challenges rather than resolution. Teresa Giudice has long been open about her cosmetic procedures, from multiple breast augmentations to regular facial treatments. But one experience in particular stood out as far more serious than the rest. What was meant to be a routine tummy tuck, a common procedure designed to tighten abdominal muscles and remove excess skin after pregnancy, took an unexpected and frightening turn. Initially, everything seemed to go as planned. However, during recovery, Teresa began experiencing complications that suggested a possible infection or healing issue. While she has not publicly detailed every medical aspect, the situation was clearly severe enough to require extended care beyond the normal recovery timeline. Instead of the typical healing process, she faced ongoing discomfort, additional treatments, and a longer period away from her usual activities. The complication forced her to step back from filming and public appearances, adding professional pressure to an already stressful situation. More importantly, it created real concern about her health. What should have been a straightforward cosmetic improvement became a difficult and uncertain recovery. What makes Teresa's story particularly notable is what happened afterward. Despite going through a serious complication, she did not step away from cosmetic enhancements. She continued with additional procedures, including further breast surgeries and ongoing injectable treatments. Her experience highlights a broader reality within the world of television and public image. The pressure to maintain a certain appearance can be incredibly strong. Even after a negative outcome, the desire to keep up that image can outweigh the risks, making it difficult for many to step back once they've started down that path. Jennifer Aydin's cosmetic surgery experience stands out as particularly surprising, especially because she is married to a plastic surgeon, Bill Aydin. With that level of professional insight at home, many would assume she would avoid complications. However, her journey shows that even close access to expertise doesn't guarantee perfect outcomes. Jennifer's early experience with cosmetic procedures started on a positive note. Her rhinoplasty delivered the refined, balanced look she had hoped for, boosting her confidence and reinforcing her trust in surgical enhancements. But her next step, a chin implant intended to improve facial harmony, quickly took an unexpected turn. Almost immediately after the procedure, Jennifer sensed something wasn't right. The implant didn't feel natural, and more importantly, didn't look the way she had envisioned. Instead of enhancing her features, it created an appearance that felt unfamiliar and uncomfortable. Trusting her instincts, she made the difficult decision to remove the implant not long after it was placed. That choice meant undergoing another surgery, along with additional recovery time and emotional stress. The removal process itself was not simple, leaving behind scar tissue and requiring her to heal all over again. In the end, she was left without the improvement she had originally sought, only the physical and financial toll of multiple procedures. Jennifer's experience highlights an important reality. Cosmetic surgery outcomes can be unpredictable, even under seemingly ideal circumstances. It also underscores how quickly a single decision can lead to a chain of additional interventions, each carrying its own risks and challenges. Lauren Simon believed she was making a practical, cost-saving decision when she traveled to Turkey for breast augmentation surgery. Like many patients drawn to medical tourism, she was offered a package that included a lower-price luxury accommodations and the promise of natural-looking results. At first, everything appeared routine. The procedure was completed quickly, and she was discharged without immediate concerns. But shortly after returning home to the UK, her situation took a terrifying turn. Within days, Lauren began experiencing severe pain as an aggressive infection developed. Her condition rapidly worsened. The affected breast tissue started to darken, an alarming sign of possible necrosis where tissue begins to die due to lack of blood supply. The pain became so intense that she struggled to sleep or carry out basic daily activities. What made the situation even more distressing was the lack of follow-up care. Once she had left the clinic abroad, communication and support became minimal. With her condition deteriorating, Lauren sought urgent medical help from local hospitals. Doctors were reportedly shocked by the severity of the infection and the condition of the surgical site. She required multiple emergency procedures to control the infection, remove damaged tissue, and prevent the situation from becoming life-threatening. Medical professionals indicated that without prompt intervention, the infection could have spread further, posing serious risks to her overall health. Lauren's experience highlights the potential dangers of seeking surgical procedures abroad without reliable aftercare. While cost savings can be appealing, her story serves as a reminder that continuity of care and medical oversight are critical, especially when complications arise. Marisol Patton's cosmetic surgery journey is often described as one of the most complicated among the Real Housewives of Miami cast members, a series of procedures that over time led to ongoing physical and emotional challenges. Her story began at a young age. As a teenager, Marisol developed a naturally fuller chest during a time when a slimmer figure was more fashionable. Feeling self-conscious from the attention, she chose to undergo breast reduction surgery early in life. However, because her body had not fully developed, the results did not last as expected. Her breast tissue continued to change over time, leaving her with both recurring concerns and permanent scarring. Seeking a better outcome, she later pursued additional procedures. Like many patients trying to correct earlier results, each step introduced new complexities. She eventually opted for breast implants to restore balance, but complications followed. In one instance, an implant shifted out of position, requiring corrective surgery. In another, she faced implant failure that demanded urgent medical attention. Each procedure added layers of scar tissue, making future surgeries more difficult and recovery more challenging. Over time, the repeated interventions took a toll not just physically with discomfort and limited mobility, but also emotionally as expectations and outcomes continued to clash. Marisol's experience reflects a broader reality in cosmetic surgery. Early decisions, especially before full physical maturity, can lead to a chain of revisions later in life. It also highlights how multiple corrective procedures can become progressively more complex. Brandi Glanville has become the center of one of the most puzzling and widely discussed health situations in reality television. What initially appeared to many fans as another cosmetic procedure gone wrong has evolved into something far more complex and deeply concerning. After reportedly spending tens of thousands of dollars seeking answers and corrective treatments, Brandi began experiencing severe and unpredictable facial changes. In 2024, she largely stepped away from the public eye for over a year. When she eventually shared an unfiltered photo, it shocked fans and sparked widespread speculation. However, the cause of her condition has not been definitively confirmed. Brandi has publicly shared that different medical professionals have offered varying explanations. Some have explored rare or unusual causes, while others have suggested conditions such as angioedema, a disorder that can cause sudden severe swelling beneath the skin. These episodes can be painful, disorienting, and in some cases serious enough to require urgent care. The condition has affected more than just her appearance. She has spoken about difficulties with speaking, discomfort, and the emotional toll of not having clear answers. The uncertainty has led her to pursue multiple consultations and treatments, adding financial strain to an already stressful situation. What makes Brandi's experience especially striking is the contrast. It reflects a shift from elective cosmetic changes to a medical issue beyond her control. Her story highlights how complex and unpredictable facial conditions can be, particularly when symptoms don't point to a single clear diagnosis.